You're my honey bun, sugar plum, pumpy umby umpkin. You're my sweetie pie. You're my cupcake gumdrop, snickums, spickums. You're the apple of my eye. And I love you so, and I want you to know that I'll always be right here. And I love to sing 2 songs to you because you are so dear.
Hi, nice to meet you. I'm student pharmacist Zara. What brings you to the pharmacy today?
Hi, Zara. So me and my baby, we just came back from the pediatrician. She was having lactose intolerance. He told me to pick up a formula from here. I think Similac Sensitive or something.
Okay, can you tell me a little bit more about what your symptoms your baby has been having?
Yes, she's been having diarrhea, bloating, burping.
Okay, and how long has your baby been experiencing these symptoms?
It's been about like a couple of days.
Okay, and what was happening?
Yeah, so she was just having the diarrhea every time she would eat.
Okay, and is there any prior history of your baby experiencing this?
No.
Okay, and when did your baby have this first experience? Where was the bloating occurring?
Yeah, so I just noticed 40 minutes after her feeding, her stomach looked like really full and bloated.
Okay, is there anything that helps the baby symptoms make it better or worse? Anything you're using at home to help it?
I would do instead sometimes like some mashed banana and feed it to her. That's it.
Okay. And is your baby taking any medications or have any health conditions?
No, nothing.
Okay. And does your baby have any known allergies?
No, none.
Okay. And is your baby experiencing anything else besides the confirmed lactose intolerance?
No other symptoms.
Are you familiar with the infant formulas? Is there anything you can tell me about them?
I've seen them before, but I've never had to use them for my other kids.
So it's your first time?
Yeah.
Okay, so how severe are your baby's symptoms right now?
They're not severe. The doctor said it's normal in lactose intolerance.
Okay, and how often does your baby experience the lactose intolerance?
Yeah, so every other couple of feedings, I can tell.
Okay, so based on what you just told me and from your doctor's recommendation, I think she would be a great candidate for Similac Sensitive. It's an infant formula that your baby can drink as a replacement for breastfeeding, especially made for infants who are sensitive to lactose. It's sold as a formula that uses a different sugar instead of lactose, which is commonly found in natural milks. And that brand name for this formula is called Similac Sensitive.
Okay, cool. How do I use it?
So you're going to take 1 unpacked level scoop of the formula per every 2 ounces of water. And because you said your baby is 4 months of age, you want to aim for about 4 to 5 feedings. And for each of those feedings, make sure your Similac and water mixture equals about 6 to 7 ounces per portion.
Okay, and how long should she take this?
The babies usually take formulas up until they reach about 12 months of age. Your doctor can also inform you when he or she thinks it's best that your baby can move on from discontinuing the formula. And when you are picking up the formula, you want to also make sure that you're checking the box for the expiration date and that the container is not dented. If any dust is on the container, make sure to dust it off before opening the container. And before you use the product, you want to make sure that you're also washing your hands thoroughly before you add the scoop of the powder to prepare the formula.
Okay, can I use the bottled water to mix it?
No, so bottled or filtered water is not a replacement for boiled water. Boiled water is used to clean impurities in the water, but don't mix the powder with the boiling water because it can reduce the nutritional value. you want to wait till the water is room temperature before adding it to the powder. And the way to test for that is just sprinkling a few drops on the inside of your wrist to make sure it's not too hot.
Okay, what are some precautions I should take?
So if the formula is already made, then you must refrigerate it immediately and feed it to your baby within 48 hours. Like I said, make sure you boil. You should never microwave the formula because it can cause burns. You already mentioned that your baby doesn't have any other medical conditions, and that would be a good thing because it is advised to contact your doctor about using infant formulas if your baby happens to have any issues with their immunity, if they're premature, or if the baby has a blood sugar disorder. And also in the beginning, when you start the product, your baby might experience some constipation, diarrhea, or upset stomach. When she starts it initially, the body will naturally adjust to it, and this is the reaction. It's common and temporary. There's nothing to really do to avoid this. Otherwise, there's no significant interactions with other drugs. But if you start her on any medications, then inform your doctor that your daughter is taking Similac sensitive. And this formula, when used correctly, will ensure your baby is receiving proper nutrition as soon as she begins it. And while your baby is receiving this formula, if any symptoms that are more severe occur, then you should definitely see the pediatrician if the symptoms, especially if they persist for more than a few days. And once you open it, make sure the powder is stored in a sealed container in a cool, dry place, and you want to avoid extreme temperatures.
Okay, what if I miss a dose?
So since this is a feeding product, there's not exact dose timings. Just make sure that your baby is reaching the amount of feeding that she needs. But since I threw a lot of information at you, I just want to know if you can tell me a little bit about how you plan to use this product.
Yeah, so like you said, I'm going to take one packet, mix it with 2 fluid ounces of water. That packet, when it's prepared, I want to make sure I use it within the next 48 hours and that it's refrigerated. And I want to use boiled water, never microwaved. And I want to have that boiled clean water cool down before I add the mixture. And then I want to test it on my wrist before I feed my baby the 4 to 5 times a day, 6 to 7 ounces per portion.
That's really good. Do you have any questions for me?
No, it's perfect.
Okay, well, if you have any questions for me, you can always call. And thank you for stopping by our pharmacy today. Hope you have a great day.
Thank you so much. You too. Thank you.
Thanks.